Master of Ceremony for this program. At the outset, I would like to express my sincere gratitude to Dr. Rasik Shah for giving me this esteemed responsibility. They say big journeys begin with small steps. The right steps in the right way, in the right direction. The voyage of minimal access pediatric surgery, that is MAPS, in India mirrors this very narrative. Starting as small steps taken by our eminent pioneers and evolving into monumental strides for the entire pediatric surgery community nationwide. This journey has elevated pediatric surgery to unprecedented heights in our country. Today, we are gathered here to commemorate this remarkable milestone, to reminisce about the inspiring 25-year journey. To extend a heartfelt welcome to all the esteemed dignitaries present over here, I have the honor of inviting the trailblazer of pediatric minimal access surgery in India, Dr. Rasik Shah, to deliver his welcome address. Sir.
Good evening, everyone. This meeting, what I am organizing today, was conceptualized 2 years back when Deepraj Bhandarkar and others had arranged 25 years of first laparoscopic cholecystectomy. So at that time I thought something we need to do in pediatric surgery also. And then how to do was question mark. I was thinking for last few months how to do this. And ultimately this has been done. And I thank all of you who has come from, not only from Mumbai, but few of my friends have come from Chennai. Vikesh is from Jabalpur, Amritsar. So it is actual representation of India also we have over here. There are many pediatricians, pediatric surgeons and my family members over here. I welcome you all for today's gathering. And it is more or less celebration we can call. My main part of the speech I will be talking to you all at the end of the last part of the talk which we have. But once again I welcome you all. Thank you very much.
So we really appreciate your idea of commemorating this occasion. Allow me to now next introduce Dr. Soonu Udani, a passionate individual whose extensive hands-on experience in pediatrics has earned her recognition and acclaim in the realm of pediatric intensive care. A distinguished healthcare leader, she served as Director of Pediatric Critical Care and Emergency Services at SRCC Children's Hospital, managed by Narayana Health, Mumbai. It is my privilege to welcome Dr. Udani to share her address with us.
Good evening, everyone. Rasik, Archana, your family members and friends. I've known Rasik for a long time. We were together at Hinduja for many years, and then almost at the same time we both moved to SRCC. I remember one of the first surgeries he did in laparoscopic surgery there was a newborn. This child was antenatally diagnosed with a lump in her abdomen, close to delivery, and after delivery she was in the unit. And he laparoscopically removed an ovarian tumor that was about this big. We were all very fascinated at that time because we had only heard about Dr. Udani doing laparoscopic surgery, and the fact that he could actually do it on a newborn, and she went home in 3 days. Today that girl is probably about 18 or 20 years old. Absolutely fine. Besides that, of course, he did many complex surgeries. But the couple of things that I will say about him that you may not know is that the fact that laparoscopic surgery we found could be done so easily became a real shift for us as pediatricians, because anesthesia has also become safer, and with this kind of minimally invasive surgery, the child was home in 2 to 3 days. Otherwise, all that nil by mouth and sutures and abdomen pain, all that was gone. And we had this confidence all over, I think all pediatricians, that we could now refer our patients for laparoscopic surgery when they asked us, should we do this? It costs so much more. Is it really worthwhile? But I think that's something you all know. I will share some personal details about Rasik that all of us know and appreciate. One thing about him, you'll see, he never has a bad word to say about anybody. If you say, oh, he'll sort of calm you down and say, it's okay, this happens, that happens. And having worked with his patients for so many years, I've never seen him in a flap. I have heard that he can lose his temper, and he has maybe a couple of times, but even when things go wrong, a tube comes out or something has happened that actually might have hurt his patient, it's always cool. Okay, we'll manage. He's probably seething inside, but he doesn't show it. He never has shouted at a nurse or a doctor or anything for something that has gone wrong. And I think he's really appreciated for that, because in a crisis, he's the man to get. I'm sure all of you are that way. I mean, Ketan is also, and all the others that I know. But Rasik really becomes our go-to man because he's there all the time. Call him up in the middle of the night. Okay, I'll go. It's that cool. The other thing about him is his discipline. We are all amazed at his discipline. He will not eat after 6. He will not do, I'm not going to do it means I'm not going to do it. And of course, he's a terrific organizer. At SRCC, we have been lucky to have his organizational skills, because single-handedly, he has made a program for general practitioners. Every alternate Wednesday or one Wednesday a month, and now 70, 80, 90 general practitioners come on Zoom. And the entire program has been designed and is actually being pushed forward by Rasik and Rasik alone. The day he opts out of that program, it's probably going to collapse. So he's a terrific organizer, and you all have seen that. So it's been a pleasure working with him, continue to work with him, and to, of course, commemorate 25 years of all the work that all of you have put in. You all have taught people minimal access surgery, you all have really shot it forward, and this is a tribute not just to him as a person, but to all you pediatric surgeons, because pediatric surgery is not easy. I think you have to take a novel with you to your consulting room for the first year at least, and then start moving forward. So to all you pediatric surgeons, to all you minimal access practitioners, Deepraj is here, he does adult work. Thank you very much for bringing this into our country and for taking it to such great heights, where I think now almost anything can be done that way. Thank you very much.
An approval from a pediatric intensivist about minimal access pediatric surgery safety and efficacy means a lot. Thank you, ma'am. One anecdote of a man is worth a volume of biography. Allow me to introduce an individual whose MAPS journey began at Nayar Hospital, resonating across generations through the guidance and teachings imparted to individuals like myself. A man whose work speaks a lot louder than his words. Dr. Sandesh Parelkar, a highly meticulous pediatric minimal access surgeon and an impassioned educator, currently serving as the head of the department at K Hospital, Mumbai. It's an honor to welcome you, sir. We eagerly await for your insights.
Thank you, Vikesh, for those kind words and introduction. I am going to pretend as I am tech savvy and keep on referring to mobile. Actually, there is nothing written in my mobile, but I am going to pretend as I am tech savvy and part and parcel of the generation. Anyway, good evening, ladies and gentlemen. It is indeed a pleasure and an honor to be in front of this august gathering. It's a special occasion to commemorate 25 years of advanced minimal access surgery that we assisted Rasik at Nayar Hospital in December 1998. Dr. Rasik Shah, Rasik Sir, Shah Sir, Rasik Bhai, Rasik are all the names that we all refer him with, and with what Dr. Udani said, with equal coolness, he replies to all of them without getting hassled about anything. I still remember the excitement that we had on that particular day when we were to operate on the girl, and the satisfaction that we could complete the procedure without any hitches. And mind you, he had got everything from his own, at his own capacity, because we were not even aware of what all it takes to make, complete the procedure successfully. It began an entire new era where our pediatric population got the benefit of minimal access surgery. I have known Rasik for maybe more than 30 years. February 1993, we met in JJ Hospital when I joined JJ Hospital. And I have to admit here in front of you that he influences me a lot, not only professionally but also personally. So I would like to take this opportunity to thank him and also congratulate him on completing 25 years of advanced minimal access surgery in pediatric surgery. He continues to train with the same enthusiasm to each and everybody who comes to him. It can be in any part of the world, not only restricted to our own country, also abroad. As far as I am concerned, I was humbled then and I am humbled now to get this opportunity to speak my mind in front of you. I cannot proceed without remembering two names. Dr. Ashok Mathur, who was the then professor and head of the department, who allowed us to go ahead with this procedure, and Dr. Sujay Das, who was a co-lecturer, you will remember me, he is now practicing pediatric surgeon at Goa, and the two of us assisted us. Of course, then Dr. Oak took over Narayana Hospital, and he took minimal access surgery at a different level. I think Narayana Hospital was known for its endoscopic infrastructure that Dr. Mathur had built up, and Dr. Oak ensured that it went on to a different height, where the first, I think, HD camera of stores, that is Image 1, was procured by Department of Pediatric Surgery at Narayana Hospital, and we completed more than, I think, 500 hernias only in Narayana Hospital, in addition to the usual appendices, the cholecystectomy, and advanced procedures like ovarian cystectomies or laparoscopic procedures. Dr. Oak went on to organize 3 workshops, and then it was an effort, in addition to the 6 effort, to popularize minimal access surgery and to try and get acceptance, because the generation before us was still, and probably is still now, criticizing minimal access surgery to a certain degree, let alone laparoscopic repair of hernia. I take this opportunity to thank all our surgical colleagues, anesthesia colleagues, medical colleagues, administrators, OT nurses, OT assistants, industry individuals, and our own patients, that is children and their parents. It was very nice to meet everybody from different corners of the world. I would like to take this opportunity to thank Rasik once again, Archana, Ravi, Ranjana and Miguel, congratulate them, and the youngest Ravina. I can't find them, they are very good. So thank you very much. Thank you for having me here. Thanks a lot.
Thank you, sir, for your inspirational speech. I remember when I was postgraduate in 2004, we used to run to a workshop to arrange the CO2 cylinder and BNC table and whatnot. And I was your closest aide, sir, while recording the procedures. So I really remember and fondly remember those days. Thank you very much. The key to an enduring Jugalbandi is the willingness of two artists to make a single portrait. Let me introduce an individual whose collaboration was instrumental in enabling the historical first laparoscopic cholecystectomy of India, working closely as the lead assistant to late Dr. Ketan Parikh. His contributions are immeasurable, notably in reshaping the landscape of laparoscopic surgery in India through his directorship in CMAS for several years. Join me in welcoming Dr. Deepraj Bhandarkar, who will enlighten us with his Jugalbandi experiences from his remarkable journey we are about to explore. Sir, please.
Good evening, seniors, ladies and gentlemen. Thank you, Rasik, for the privilege and the honor of being amongst this elite crowd. So, when I think about Rasik, one thing that always has bothered me, that he was 1 year senior to me in JJ, but I never somehow could place him as being a GM side. And why was that? And this got me thinking some time ago. In JJ it was a tradition that one batch senior to you always ragged you. And then you ended up being their best friends. Now knowing Rasik after so many years, I am sure that Rasik never ever ragged his juniors. And that is the reason when he was in JJ, I somehow didn't know him. How did I come to know this gentleman? I came back from UK end of 97, and one day I went to meet a friend of mine, Prakash Agarwal, who is an ophthalmologist. And Manoj asked me, so what have you learned, what did you train in the UK? And I was all enthusiastic about telling him about laparoscopic surgeries done through small incisions. We put in some ports, we put in carbon dioxide. And Manoj suddenly stopped me. He said, wait. Do you remember Rasik from 1 year senior batch? He was with me just half an hour ago and he told me something, he's doing something similar in kids. I said, oh, is it? So I must meet him. Where is he? So I said, oh, he's just gone off to the CC. That is the common canteen to have a cup of tea. So I rushed to the CC, introduced myself to Rasik, and there began the journey of friendship that has lasted so many years. I did learn a lot from him by way of surgical skills when I assisted him for some of his cases. We had decided that since we did have always residents and fellows in the hospitals where we were attached, we would help each other for our laparoscopic cases, be each other's camera person. And I can still never forget the first pyloromyotomy for which I scrubbed with him. I went to the OT and I started actually searching for the patient. And there was that patient, little thing, wrapped in silver foils, wrapped in Gamgee bandages. And I said, Rasik, why are you doing this? I mean, I had never worked in pediatric surgery, I had not done a post in pediatric surgery. He said, no, because the baby needs to be kept warm. And in that little baby, he so delicately and beautifully performed a laparoscopic pyloromyotomy. So I learned some of the laparoscopic procedures, including VATS, thoracoscopic procedures for him. Over a period of years, got to know his family, Archana, who is the rock of Gibraltar as far as Rasik goes. Always supportive, a very capable lady in her own right, but always supports Rasik in every activity that he does. And obviously two beautiful daughters, Ranjana and Rabina, who we got to know as a family. Over a period of years, I realized several qualities that I admired in Rasik. They have been spoken about. A fantastic surgeon. But over a period of time, we realized there were three things that we had in common. Our love for laparoscopy, a passion for teaching and training the younger surgeons, and publishing or medical writing. In fact, just to get the number accurate, I today opened my CV and checked how many publications we've had together. And the number is 21. So there are 21 papers that we've published together. And the steps that he took later on, the leadership positions that he held in several organizations, pediatric surgical organizations, came as no surprise because of his temperament that Soonu alluded to. He is always the coolest person in the room. I have never seen getting hassled about anything, be it in the outpatient, in the OT, in a room full of people where some heated discussion is going on. And he has always maintained that throughout his career, and that's probably one of the reasons why he is so loved by everybody. But I'm going to share a secret with you. He can be tough if he wants to be. And I'll end this with a small story. So I was assisting him many years back for a laparoscopic splenectomy in Hinduja. The fellow was holding the camera. It was a large spleen, so Rasik said, please scrub with me, be my assistant. So my job was to retract the spleen with the help of a suction cannula. And the job was, if there was any oozing, the suction would go in, suck that area of blood. But the rest of the time I was expected merely to retract the spleen so that it would work on the hilum. And after a while, the surgeon in me got the better of me. I started using that suction cannula to try and poke around the vessels in an effort to dissect them and to show them to Rasik. So at one point in time, he suddenly left his hand, he got the instruments out, and he looked at me. He said, there can be only one surgeon in the room. So if you want to do the surgery, please come on this side and go ahead with the splenectomy. I trust you will do it safely. But if you are on that side, you are an assistant. From now on, only retract the spleen. So, I mean, people say that he's a nice person, but yes, he can be tough on occasions where he has to be. So, thank you, Rasik. It's a wonderful occasion, and wish you all the very best now and always in the future.
A friend like this is a bliss indeed. So, you said there are 3 things in common between 2 of you. I add 4 things, sir. Both of you encourage youngsters from your heart, sir. Because I got first invitation as faculty from Dr. Rasik. And my first editorial got published in your journal when you were editor in JMAS. Thank you for that. Now, allow me to introduce another trailblazer in the field of minimal access pediatric surgery in India. He has served as the past president of Indian Association of Pediatric Surgeons and as the former chairman of Pediatric Endoscopic Surgeons of India. I had the privilege of working alongside him as honorary secretary. Dr. Ketan Parikh is credited with pioneering the initiation of minimal access pediatric surgery in nursing home setups and breaking barriers for its widespread adoption in its currently evolved form, as we witness it today. Join me in welcoming Dr. Ketan Parikh as he addresses us today. Thank you, sir.
Good evening, seniors and all your friends. It's very nice to be here at this occasion when Rasik is celebrating his 25 years. I have known Rasik for a little longer time than that, but that was very vaguely. As a GM side, as a part of the GMC Pediatric Surgery Department, and earlier also we have known each other, but I didn't know him very well. It was somewhere around 98 August, September that I came back after a short course from UK in pediatric laparoscopy, and I came to know that Rasik had properly trained in pediatric laparoscopy, and we incidentally met and decided to start working together. I think it was a very fortunate moment for me when I decided this. I have had the privilege of having learned from him so much. He is an excellent mentor. He has been an excellent mentor. It was, I think if I learned my pediatric laparoscopy, it is definitely because of him. Of course, I used to help some of my adult surgical colleagues for laparoscopy earlier. And during those early years when both of us started doing pediatric laparoscopy at my center in Karkobar, he has been helping me so patiently for doing all the cases. I remember our early lab appendix used to take, not the bad ones, but even the average ones would take 2 hours, and he would be holding the camera for all those 2 hours very patiently and assisting me and helping me. And I am really indebted to him for that. Of course, subsequently I have seen him through his early struggles and admire his grit, because I know he went through a lot of struggles for at least few years after that, and his grit was phenomenal, his commitment was phenomenal, and of course we are all seeing the evolved Rasik, and it's a great thing to see you like this, Rasik. Congratulations to you, congratulations on your journey. Thank you very much.
It's just a perfect combination of vision and mission, these two guys. Now I introduce to you Dr. P.G. Samdani, a highly esteemed and senior pediatrician in our country, whose extensive experience spans over 6 decades, witnessing the growth and advancements across various fields of pediatrics. His insights and observations on the emergence of minimal access pediatric surgery are sure to captivate and enlighten us all. A warm welcome to Dr. Samdani sir.
Friends, it's a great occasion to be here and talk to the people who are most esteemed in the field of pediatric minimal access surgery and laparoscopic surgery. I have nothing to do with the surgery. I am wondering why am I being involved here to talk about it. I remember the days when I joined pediatrics. I'll speak a little on the pediatric part and then go to the surgical part. 1966, when I was an intern, I started my pediatrics. I did 3 months fixed pediatrics, where we had no scalp needles, we had no vein flows. Either you do a mini section or give paraldehyde and sedate the child and start with femoral ribs. So those were the days where we started with our pediatrics. And then came the era that there were no sonographies, there were no CT scans, no MRIs, no investigatory facility to guide you further. So we started with an era where facilities were not available, no Google. You can't search anything, you got to go to the library, old library JJ, look at the books which are 20 years old and 10 years old and 15 years old, and look into it and get some answer out of it, if at all you can get an answer. So what was it? Listen to the history, examine the patient, and come to a conclusion as a spot diagnosis with the data which have been given to you, without the help of all other gadgets which are available today. So today's pediatrics and pediatric surgery is much wiser as compared to what it was in the past. 1995, Rasik, when I was at JJ, it was an honorary, Rasik came and met me and he says, I have 2 or 3 opportunities now to do, what should I do? He says, pediatric minimal access surgery, there is laparoscopic surgery, fetal surgery, and some other branch which he wanted to divert in. I said, I don't understand anything. I only understand that probably laparoscopic surgery should do well for you, because that's the time where you need to know the minimal possible exposure of stay in the hospital for a patient and go home early without complication. So then he opted for laparoscopic surgery. It's not me, but probably he had an inclination and I only supported him to say that all right, laparoscopic surgery would be good. Now those were the days where a pediatric surgeon, pediatric surgery was done by general surgeons. Dr. R.A. Irani, who was a general surgeon, started the pediatric surgery at JJ. So those were the areas where there was a lot of resistance and difficulty in doing a pediatric surgery by a general surgeon who didn't do and didn't get qualified for pediatric surgery. And those were the days the pediatric surgeon used to do shunt surgery for hydrocephalus, teratoma surgery, meningomyelocele and meningoceles in pediatrics. All these surgeries were done by the pediatric surgeon. I still remember the Hirschsprung's disease was being operated where they had to do it in 3 stages and not pull through in 1 stage, which Rasik does it now. So therefore, the pediatric surgery has become much more easy, good for the patient and good for the pediatrician in giving him the results. Because finally what happens, the patient is referred to a surgeon. The patient looks at the pediatrician primarily because he has met the surgeon for the first time. So he keeps asking us what next, what is happening. So therefore, that gave us a confidence to say that look, you are in safe hands, you are in quick hands, and you are back home easily without much trouble. So that was the pediatric surgery in those years, where now we have a subspecialty of pediatric neurosurgery, pediatric orthopedics, pediatric ophthalmology, many more things have come up. So now pediatric surgery, minimal access is gaining more and more ground because all abdominal surgeries you can do laparoscopically so well, which primarily conventional surgery wouldn't do. I think it's a great achievement for laparoscopic surgeons and especially Rasik to get onto this line and become a mentor to many for laparoscopic surgery. Thank you.
So much, sir, for highlighting what we call nowadays is modern pediatric surgery. Now I would like to introduce a luminary in the field of pediatrics, a level teacher who has inspired numerous generations and dedicated his life to enhancing the health and quality of life of children in need. There is no one better suited than him to shed light on how minimal access pediatric surgery has influenced surgical care for children. Please join me in welcoming Dr. Amdekar.
Friends, at JJ Hospital we are very lucky that the entire pediatric department was housed in one building and the surgeons and physicians work together. So I have seen over the last 6 decades how we work together and I have seen a drastic change in the outlook of people as well. I remember the days when the senior surgeons were not ready to accept a laparoscopic surgery. And there was often a fight between the father and the son, or the father and a close relative. And I think it was very clear to me that in medical field, we all are students forever. And we need to look at what better can be done. And I realized that as I get senior, it's my turn to learn from juniors what I have not learned and hopefully give them also something that they have not done. And I think this intergenerational coordination possibly is the result how the minimal access surgery has gone so far ahead. I want to share my own experience. I had to undergo a Whipple's. And believe me, even surgeons who were 20 years younger than me were all against my going through a laparoscopic Whipple's. And they brainwashed me that what I had decided was not the right thing. But luckily my own son-in-law, being a laparoscopic surgeon, he convinced me that that's the only way. And I tell you that 8 hours of Whipple's laparoscopically, in less than 24 hours, I was made to walk. And I had hardly recalled any significant pain. I realized how the technology has advanced so much that it is so beneficial. And I just want to stress that till the last day, well-wishers were advising me not to go that way. I realized how narrow vision of some of us seniors really comes in the way of progress. And we are not ready to look at somebody junior who is doing much better. And there is no shame in accepting that I can't do it. But I am very proud that he can do it. And after all, we all do for the best of the patient. And we could remember the technology now. And I want to just make 2 points as we go ahead, even in pediatrics, laparoscopic surgery. I think the science is advancing so fast that one author has said that you have to run twice as fast only to realize you are living at the same place. And this is so true today. And another author has said that if you are not keeping up updated, you check your academic pulse, you may be dead. I think we all need to kind of keep updated. After all, for the benefit of my patient, I must get the best outcome through the best technology and through the best person. Then I started realizing why some of the senior surgeons were not very much accepting the advances that are occurring. And my own time, I realized that the skills of doing a laparoscopic is something different than having an appendicectomy done through a large paramedian incision. And I thought it was the skill that they had not learned, and instead of accepting that they would either learn or they would accept somebody else has already learned, they always shunned off everybody who was doing something new. And I feel that is the way. Today's laparoscopic surgeon may find something much better coming in the next 5 years. I do not know, as a physician, how does the robotic surgery place with the laparoscopic surgery, but whatever I little know about it, maybe the technology like robotic surgery may have a perfect way of taking incisions or going across, but I imagine both require different skills, and I was told that a robotic surgery also needs a very good fine movements of the fingers to operate it. Tomorrow something new might come. So people like Rasik Shah and others may have to be keeping eyes open to see what more they could do. And I am so happy that majority of the surgeons today and we as physicians accept that whatever is the best, much of less pain, much of small hospitalization, and you are out. I think that has been a tremendous thing. Lastly, I have one question to all seniors, and Dr. Oak is here and many of you here. The advances have taken place only in technology, only the techniques. But as we look at science, we are still tremendously ignorant about why something is happening and how that is happening. And there is hardly any research on that. If a hernia recurs, you would repair again. But you would not worry why it recurred. I'm sure the patches came in as one more, but again, that's not the way to be sure that it will not recur. So the question remains that would subsequent generation of surgeons also consider what more research needs to be done more than technology. Technology, yes. The technology comes from many and the surgeons use that. But technology is just one aspect. I'm sure it has made a lot of difference. But if science has to improve further, then we must go to the basics of why it is happening. We may not have an answer, but I imagine, sir, surgeons have never thought why it is happening. They have always thought that we could repair it. But repairing is one thing different, and anything that is repaired cannot function the way it was naturally done. I hope the subsequent generation takes not only the technology ahead, but also the whole science ahead, and it's only with such cooperation that we will win over. I congratulate Rasik and all of you who have done so well extensively. Even I have never seen Rasik lose temper at all, so I know Dr. Bhandarkar said he can. And now I'll certainly take care of not disturbing him. But he has been one of the coolest surgeons. And during my undergraduate and early postgraduate days, I have a vision of a surgeon who can throw an instrument because it is blunt out of the room. That was a surgeon. And today's surgeons are more noble, I suppose. Thank you very much.
Thank you for your enlightening words, sir. But truly, like on a lighter note, ask the youngsters that he loses his temper or not. We will be the right person. Just on a lighter note, he has always been kind to us. Nita Fazli, in his profound words, कभी किसी को मुकम्मल जहां नहीं मिलता, कहीं जमीन कहीं आसमान नहीं मिलता। ये क्या अजब है, सब अपने आप में गुम है। ज़बां मिली है मगर हम ज़बां में नहीं मिलता। The individual I am about to introduce now stands in defiance of these words. Allow me to present a distinguished figure, an esteemed teacher, a prolific Marathi writer, an influential weekly columnist, a perceptive administrator, and an outstanding orator. His impactful contribution in the field of pediatric surgery, medical education, and transformative healthcare in India precede any formal introduction. Join me in welcoming Professor Dr. Sanja Oak as he shares his enlightening words with us.
Good evening. My mind goes back to 1999 when I was transferred to Narayana Hospital to head the department. And I had an esteemed dean, Dr. Nilima Shirsagar, young one, who said that let us develop this place and what you want. And I asked for a set of paediatric laparoscopic instruments. I must be honest that since 1999 till today, laparoscopy has been my fiancée. And like a true fiancée, I love her and she dotes upon me. But how did I learn the laparoscopy? You have described Rasik in multiple facets, true to every word. But taking Nida fastly ahead, कहीं ज़मीन तो कहीं आसमान नहीं मिलता, यहाँ कहीं लाइट सोर्स तो कहाँ इंसुलेटर नहीं मिलता. That was the situation. And here is my friend, who in his blue-colored esteem, the dicky packed with insufflator, camera, instruments, everything used to come at 8 o'clock at Narayana Hospital, and the entire department, few of the residents were wrestlers, would be standing down to pick it up. I remember Deepraj is one of the lectures when Deepraj has shown that many laparoscopic surgeons got their lumbar problems not because of laparoscopy, but because of taking those initial instruments out of their car dickies when we used to travel from one place to other with this, and this gentleman did it. We were almost at the same age, and he never thought that he's creating a fearful competitor by teaching laparoscopy to someone else. I learned my alphabets from him, and therefore on every podium subsequently I have said, here is my teacher who made me realize what this faculty can do. Something is more important. We all struggle to get honorary attachments, and then even after retirement, Professor Emeritus and whatnot. He knew well that his appointment to BYL Narayana Hospital is an exception, and he's there for only 6 months. On the first day, both of us knew that at the end of 6 months we have to part the ways. So whatever skills we have to pick up, we must do so in the first 6 months, and not subsequently. He would be on board with us. And when we parted as great friends. Not even once Rasik made efforts to get an extension, which I now find even after retirement people trying to do. Rasik went away with a very happy mind that the department has germinated the seed of laparoscopy. I must remember, just as Ashok Pathuria said, we must remember Combo, Octan, Antarbudana, and one more person I am forgetting, where we did our first 4 laparoscopic workshops. There were Indian Felicitation. We do so. There were Indian counterparts in the form of Srimurti, Ramesh, Vikesh Shah, and few others. Well, friends, lot of things have changed in last 25 years. I didn't just change the administrative portfolios. Even today, my my every morning begins with laparoscopy and surgery in the private sector, and then subsequently in Sion Hospital. What has changed is the thought process. Now I set up hospitals. I build hospitals on a massive scale, and just now, having completed 2 main projects, I am setting up 850 bedded hospital and health city near Dhule. What has changed? Today, 25 years back, we had to struggle to get even a single chip camera. Today, the promoters of the hospital tell me, sir, include integrated theatres and include a 4K or a 3D lab system in this particular setup. That's the change of the thinking process. Robotics, some of us, some of our friends are doing it. I still have my reservations because here the administrator in me asked me the cost-benefit analysis ratio of this entire procedure with the consumables per case costing it so high. But it's a good feeling that Indian counterparts are now coming up, and yes, just as Amdekar sir said, in the next 5 years there would be more and more robotics infiltrating everywhere. All that I can say, Rasik, I am truly indebted to you. Hospital administration, having done it for last 18 years and still continuing, I can tell you, is one of the boring jobs. It distresses, D-I-S-T-R-E-S-S, and what distresses, D-E-S-T-R-E-S-S, is laparoscopy. So even today I ask, can this be done laparoscopically? The only thing that has happened, that has changed, so you touch base upon Dr. Palanivelu's work. He has been a great teacher in wherever and whatever laparoscopy shaped in this country. I think what has changed now as a pediatric senior surgeon is a more shift from being lapro-lunatic to a thoughtful person when he would say, this case is not meant for laparoscopy. Let's still open it up, and there is wisdom, there is prudence in that. So there are indications which are laparoscopically, generally a true cryptorchid test is, you can never do it better if you are not doing laparoscopy. But whether we should stretch it everywhere to an extirpated limbs and other thick cases, answers in my mind are still no. So after 25 years in laparoscopy, and seeing wonderful work being done by my colleague Sandesh, who parted for thoracoscopic works, there are issues when one needs to choose judiciously the cases and do the right selection of cases. Rasik, thanks to you from the bottom of my heart. You know it, and I have told you that I have stopped doing public speeches. It's a mandate that to me I think I have spoken enough. But yes, Vikesh and you make an exception. Thanks all.
Really so much to learn from such a huge experience, such a vast experience. Now I present before you teacher of teachers, a remarkable woman who has been a leading figure in both the academic and surgical realms of pediatric surgery in India for decades together. Dr. Jyotsana Kirtane is a beloved and deeply respected mentor for many of us. Madam, we eagerly welcome you to share your invaluable pearls of wisdom with us.
Everybody, it gives me immense pleasure to be here today, part of this fantastic celebration. And it fills me with pride for you, Rasik. I remember a long time back, I feel like saying once upon a time, when Rasik entered as a postgraduate student in JJ Hospital. A quiet person, a man of few words. But he absorbed everything that was going on. And if I mistake not, I think he taught the MCH pediatric surgery exam. And then he was preparing for USNLE. And it was Providence, whatever you call it. He got into Tennessee to work with Tom Rowe. I still remember he had applied to several universities, and those were the days I don't think I had a cell phone. I got a landline call from the anesthetist of Tom Rowe. And he said, Dr. Rasik Shah has applied, and we are considering what is, as head of the department, what is your opinion about it? And of course, I told him the truth that he is very conscientious, very sincere, committed and passionate about his subject. And it was, then there was no looking back for Rasik. He went there with his family and he went there, he saw and he conquered. He literally absorbed everything there also. He also worked in a cancer center, and but of course his heart was in laparoscopy. And when he came back, in between he had come back on a holiday and he addressed us, and I saw such a drastic change in his personality. He was more confident of delivering whatever he was saying. And when he came back finally, carrying baggage from the US, I still remember, as Sanja Oak pointed out, in his esteem, which I think he had got second hand because he was just starting. He would fill it up with all his bags of laparoscopic instruments and go from place to place. Unfortunately for me, I tried to get him into JJ, but corporation is easier than government. And I failed in that, but I was happy that he got into Nair, and then he didn't waste a single minute. I think that was a platform which was win-win situation, because for him it gave him a general hospital where he could practice his skills, and at the same time the recipients, the residents there, Dr. Parelkar and Dr. Oak, everybody picked up pediatrics, laparoscopic surgery from him. But it is said that knowledge is no knowledge unless you share it. And that is what Rasik has proved. He has trained so many pediatric surgeons in the art of laparoscopic surgery. And hats off to you, Rasik. It's not just the CMAS, but in every of each conference of ours, in the pre-conference workshops, he has demonstrated surgery. And what everybody has said, I would love to reiterate, that he has immense patience. I'm not exposed so much to laparoscopic surgery. I assisted him once in one of my cases in the City Hospital, if you remember that. He doesn't get frazzled, he doesn't get upset about anything. However difficult the situation may appear, he just takes his time and patiently, slowly and steadily, he finishes his job beautifully. From what I had seen him as a postgraduate, he's come a long way. Today, he is a very well respected senior laparoscopic pediatric surgeon, and he has earned it. He's earned this respect. People love him because he has made their careers. There's so many pediatric surgeons who are now totally into laparoscopic surgery and who are doing so well thanks to Rasik and his training. 25 years is a big milestone. I didn't realize it was such a long time. You brought it up to me. And you have really done extremely well. So all the best in future for steady progress and a silver turn to gold. And I would be there to attend that. No. I'm already almost 80. So all the best to you. And of course, your family. Now you've got one more promotion. You're becoming a father-in-law. So congratulations for that as well. Thank you very much.
Such a beautiful scene, gracious and a big heart, appreciating a big surgeon. It's always a dream come true for any student, ma'am. Now we invite Dr. Vijay Singh, who is the Director, Karnataka Cluster and West Cluster of Narayana Health. He joined Narayana Health in 2006. He is an MBBS graduate and holds MPhil in Hospital and Healthcare Management from Miglani. May I request him to enlighten us with his thoughts.
Good evening, everyone. I think firstly I would like to thank Dr. Rasik for having given me this opportunity to be a part of this august audience, and a wonderful blend of family, friends, professional colleagues, and the kids around. So yeah, I just made it a point to be here on this wonderful occasion for the wonderful person that Dr. Rasik is. and I think all of them have actually mentioned everything so true about him. I can only say that the first time when I saw him, he came up as a very firm, very stern person, but never imagined that this is such a composed, such a calm person within. And it's been wonderful. He's been associated with Narayana Health almost NHSR since for the last, if I'm not wrong, about 6-7 years now. Having done a couple of thousand surgeries, wonderful work, and it's been really wonderful to have him on board. He chairs many meetings. He mentors all the youngsters in the hospital. He comes up with such wonderful advice and wonderful insight in many events of the hospital. So, and I would only like to congratulate him on this wonderful occasion of having completed 25 years of the phenomenal work that he's been doing. And no better day than this day, one day before the daughter's wedding, and I think I would like to congratulate Archana Madam, Ranjana and Vikesh on this wonderful occasion. It is definitely a beautiful blend of events, and I think I can only but thank Dr. Rasik to make me a part of this event. Thank you so much, and I'm really privileged to be among all of you out here. Thank you and congratulations on both personal and professional. Thank you so much.
Dr. Singh, I congratulate you for giving such a comfortable environment to the surgeon in your hospital, because that makes the secret of the success for any surgery. Now, if we say, like any journey, the success is the thing which we enjoy most. But something more than success which we enjoy is the company when we were traveling that journey. So now I would like to mention there are certain people who have been pioneers, motivators, mentors, trainers, and who took the pediatric minimal access surgery forward in our country. They are with us, Dr. Prakash Agarwal, who is currently chairperson of Pediatric Endoscopic Surgeons of India, Dr. Robert Antony, Secretary of Pediatric Endoscopic Surgeons of India, Dr. Dasmit Singh, who is past President of Indian Association of Pediatric Surgeons, Dr. S. Ramesh, who has been past President of IAPS and one who initiated laparoscopic program, Dr. H.T.S. Miglani from Amritsar. I would like my friends to come over here, and if they want to say a few words, they are most welcome. Dr. Ramesh, please.
Vikesh, this is rather unfair. You never told me that I had to talk. As for so many luminaries, but anyway, I speak from my heart. Rasik has been a very close friend. Right from my MCH days, in fact, I remember him being the expert assistant, trying to help me during my MCH exams. Actually, we started our laparoscopy in 97-98 in the entire landscape around Rasik, what he said. When Dr. Shivamurthy was basically a general surgeon and he started his laparoscopy, he wanted to turn that foray into pediatric surgery. So then he used to bring the way he said, no, there's a car full of a different car. Okay, he used to get all his things and we used to do it in the government hospital, we used to do things, struggled around. Then he said, why don't we popularize this? That's the time when we wanted this workshop in 2001. Pediatric laparoscopy workshop, then you were skin, sir, Oak, sir. Then we said, who's the Indian faculty in pediatrics? We called Meera Luthra, we called somebody else. I said, why don't you try Rasik? I said, I know Rasik very well. That's the time he came, he participated. I remember him doing fantastic surgeries. I learned a lot from him. I remember learning about empymas from him, transanal endorectal put through from him. And it was mutual. For example, thoracoscopy, we were discussing when he started doing. I think it has been a fantastic journey. Along with, I have to mention two other things about Rasik. Rasik Bhai is such a fantastic leader that he is the one who sort of mentored me through IAPS. When I was actually enthusiastic about moving on, he is the one who spotted my talent, brought me into executive committee, made me a secretary, and I was very lucky to have him as a president and as a secretary. Like I think everybody has told so far, his patients have been phenomenal because I am the most disorganized guy, there is the most organized guy. At any time I had a problem, all I needed to do was to call up Rasik and he used to say, "Arey, isme kya hai?" I tell me what is personal stake at it. Nothing, no? Whatever has to be done, do it. Don't bother because you've got nothing. Thank you, Rasik. That helped me even subsequently. I used to have such long conversations with him. My wife used to ask, is it Rasik or Rasika? So I said, no, you should see him. Rasik has truly been an inspiration. And like always say, learning is something, doing is something great. But the greatest of all, which is all of you have said, is about training people. I think he has been the forefront of laparoscopic training in the country, and he has been mentoring, more than just talking about it as mentoring. In fact, he has been a true inspiration to me. In fact, we've also trained a lot of people, we've also mentored a lot, but full credit to Rasik. And beyond all those things, apart from Rasik also, we have to keep in mind around the same time that it started, the journey just spread across the country, and laparoscopy is now a big entity. Thanks to people who supported, took it forward like Sanja Oak sir, and Madam is no less because, supporting wise. Because every time I come, from the bottom of your heart keep saying, I still remember Madam, we had a lab training course when we envisaged our teachers coming. Ilameshwari came, you were supposed to come, Bharati Kulkarni Madam had to come, Manisar did come, Prakash Agarwal came. There are teachers. Like I said about encouraging, these are the people who are our teachers, who are willing to come and learn from us. I think that is an emotional moment, and that is the degree of magnanimity which actually supported it, has taken it forward. And like I said, today, laparoscopic surgery has come so well, it is no more a question of is it possible, is it safe. It's just like I was telling the other day, to set standards, to make sure that it is more effectively done. We don't need to sell it anymore, but it's quite safe. Rasik, like Madam said, the Silver Jubilee should become Golden Jubilee, and wish you very, very much, and we hope you are going to take it forward. Thank you, Rasik.
Thank you so much. I remember Dr. Ramesh for one particular thing. In all festive workshop, he used to sit behind the curtain at the console regulating the audio visual, and I learned that from you. Dr. Dasmit Singh.
Rasik bhai, as we fondly called him always, when he went for his USMLE, in the heart of hearts, I had come from Pune, from Vijay Medical. It's a very laid-back atmosphere. In fact, I did not join KM, I joined JJ for paediatric surgery. And the reason was because I wanted to be in a completely relaxed atmosphere. And that's what I did get at JJ. When Rasik decided to go for his USMLE exam, in my own heart, I said, this is a man. This is a man. He never stops. And that has continued. Always continued. He kept pushing people, he kept pushing us, and that has made all of us what we collectively are known as a better, where we will always try and solve problems together. And not just a question of clinical problems, we are talking about the Indian Association of Paediatric Surgeons and how to take this entire journey for paediatric surgeons forward. Everything was mentored by Rasik, and it is still being continued. It's absolutely fantastic. Rasik, thanks to you. All of us really trained hard because you pushed us. And till today, we are still taking so much of guidance from him. His videos on YouTube are, I think, the most popular ones even today amongst all the youngsters. CMAS was another fantastic journey in his life. Again, pushed people, and that shows his mentorship skills. So we are really indeed indebted to you. Thank you so much.
Thank you so much. I have personally observed your unconditional and unwavering support, sir. Now I call upon Dr. Prakash Agarwal.
Good evening, friends. It's absolute nostalgia here. I was a spectator to this history being made at Narayana Hospital, which Oak sir told that when Rasik sir used to come with his bag full of clothes with all the instruments, we were the residents who used to pull it and take it to the OT. So I feel very happy that I am a part of this whole journey with you, sir, and feel very proud to be here today. for this momentous 25th year that we are celebrating today. If you would not have come to Nair, I don't think you would have taken the journey of laparoscopy. And what I am today is because of laparoscopy. My whole identity, I feel, is because of laparoscopy. Now I would like to mention 3 or 4 people who have made my life in this laparoscopy. First, Rasik Shah came into Nair and we started doing laparoscopy. Then Oak sir was a very big motivator. When he started doing laparoscopy and we were all in awe that okay, this is something new which we can take. We had seen in our general surgery days, but we never thought that in pediatric surgery when we will join, we will start doing so much of laparoscopy. And I feel very lucky that I was in an institution where Oak sir and Sandesh sir were the leaders and they took it to a further greater height. And then it came to such a level that we started organizing international conferences. Oak sir had invited Tom Loeb on the request of Rasik Shah, who was his mentor. So that was a very nice international workshop that we had conducted. And after that, the second workshop, Rockton came, and then I had gone to drop Rockton in the airport, and we were having a chat that what all you do over here. And when he learned that we do duty 24 hours a day, then he told, where do you sleep? I told, we sleep in the ward, sir, in the patient trolley. He was so impressed with that. He told, would you like to come and work with us? And that is the starting of my journey. We went abroad. He asked, oh, sir, can I take him? And he was very graceful in agreeing for me going to Rockton. He was a world leader in laparoscopy that time. So we got the opportunity to go to Adelaide with Rockton and learn further laparoscopy. Well, this is the journey that we have trained ourselves. A lot of moment came when Rasik sir supported us as a youngster in the national forum. He made us faculty, he made us come to CMAS, he gave a lot of support. But when I came to Chennai, the other person who helped me was Dr. Bhakti. You train yourself so much, but who supports you for practice? Dr. Bhakti was there to support me. Whomever he will introduce is a pediatric laparoscopic surgeon. He was a big PRO for me. So I would thank you, sir, for supporting me during my initial part of my career when I came to. And as one of my bigger mentors told, that if a teacher teaches one person, it is not that person. Through him, he teaches thousands of other persons. So Rasik sir, I feel what you have taught us and what we have disseminated, you would have taught about more than 1,000 pediatric surgeons in this country for laparoscopy. Thank you for being here. Thank you.
For speaking from absolutely bottom of your heart. Now I invite Dr. H.P.S. Miglani from Amritsar.
Good evening, friends. It's indeed a pleasure to be part of this Silver Jubilee celebration of laparoscopic surgery in the pediatric area. I belong to Amritsar as Dr. Vikesh has introduced. It's a small town compared to Mumbai or Delhi. And when I came as a pediatric surgeon qualified from CGI and wanted to set my practice in Amritsar, my very own teachers who gave me the MS degree, they said, don't start a pediatric hospital. I said, why sir? बच्चे मर जाते हैं. I was taken aback. But then I was determined to set up my own place because institution support is not there in smaller towns. And then came laparoscopy on the scene. Very soon after my passing out in 1996, this laparoscopy world was a buzz in the country. And I developed this inquisitiveness to see and then to learn laparoscopy because that was the main thing. And first steps I learned from Coimbatore. Before that I purchased the laparoscopy set because I firmly believe that if you want to learn driving, you should learn with your own car, so that if you bang somewhere, you don't have to blame somebody else or things like that. So I had purchased the set before learning laparoscopy, and then I was like the Eklavya. I could not have the privilege of coming to an institution again and learning under a regular mentor. But from Mumbai, Rasik Sir and Ravi Ramadwar were two people. I am missing Ramadwar here. Is he not around? Oh, okay, he is somewhere else. So these two people held my hand. Rajamani from Coimbatore held my hand, and I started my small infant steps in laparoscopic surgery. Gradually from all IAPS conferences, our association has been very supportive. They gave me 2 fellowships, and hesitatingly I asked Rasik Sir, he was working in Hinduja at that time, sir, can I come to your OT to observe? He said, yes, but I have to take permission from the thing, and after some time he said, yes, you can come, I will do the needful. And he was gracious enough to allow me to his OT, and observing them and observing the workshops, I learned my steps in laparoscopy, and now I can do little bit in a small town like Amritsar. And words cannot be enough to express the gratitude that I have for my mentors. Although I didn't have the privilege of directly working under them, or I learned a lot of lapro when I came in 1999 when Dr. Sanja Oak had that robotic workshop with ESOP. I still remember the name. And that's where our eyes opened, and we could germinate one such seed in Amritsar also, which is a far off place as compared to the rest of the country. It's a border town. And I'm doing a bit of laparoscopy there. Not as level as Rasik Sir, but still I am trying to promote it. Thank you very much.
Thank you so much. Now, I would like to invite Dr. Meera Luthra from New Delhi, who has been another companion of progress of pediatric minimal access surgery in India and has been past chairman of pediatric endoscopic surgeons of India. Ma'am, please.
It wouldn't have been complete, you can't bypass Delhi for Amritsar. So Delhi was actually behind on laparoscopy, and it was a struggle. I first saw Hoptan doing surgery in 1987, and it took me a lot of time. People thought it was unethical, you couldn't do it. It took 14 years. It was 2001 when we sat together during the earthquake in Ahmedabad. And we spent the whole day together, Dasmit, Rasik and I. The whole day we spent from morning till evening because there was no meeting. And I said, I have to do something. Including some of the institutions were against lab. That's when I decided that I took 3 months off my practice, went to Australia, trained for 3 months and came back, took Rasik to help me operate in Delhi, came to Bombay with Dr. Jyotsana Kirtane and Rasik, and we went around in his car and we carried all the oxygen. I actually invested by taking a loan, buying instruments, and I said nothing short of buying Carl's clothes. Then we bought some other company with Rasik and got started. Many hospitals, I would carry these instruments in my car. I still have a light source. So I had to do exactly the same path, except that I was 14 years behind and struggling. So Rasik helped me, and because Rasik was eager to start the speciality, to promote it, that's when Delhi and the other institutions slowly came forward. And between Ravi and Rasik and Ketan and Ramesh, they are my sounding boards. So whenever I need help, I will give a call and say, tell me what we need to do. So it was, the whole start of PESI was all this group together, and I broke into this bastion, as you can see, of all these male surgeons, and we would sit together in all meetings and finally plan PESI. So thank you very much, Rasik, and I wish you all the best. I didn't have a godfather like Dr. Bandi who helped Prakash set it up, but nevertheless we did the journey, and thank you once again and all the best.
There will be many such inspiring stories amongst people here. Now I would like to invite Dr. Antony Robert. The program is getting a little serious, so he proposed that he is going to make it lighter, I guess.
speaking. I'm a little nervous, so let me open my notes, because without notes I can't speak today. So, yeah, we gather here together to celebrate this silver wedding anniversary of this lovely couple. One looks back at their 25th wedding anniversary. The couple not only remembers their honeymoon spot and their honeymoon joys which they enjoyed, they also remember the potholes and the long fights which were there. So as we celebrate this wedding anniversary of RS and MAPS, which happened in this city, sorry, I think I opened the wrong one. So sorry. Okay, we've gathered here to celebrate the beautiful partnership of MAPS and MAS, aided by the efforts of so many of our seniors in the Indian laparoscopic pediatric surgical circles. And as the secretary of PESI, I'm here representing my president, Dr. Miglani. It's my honor to acknowledge the many struggles of so many of them in this field. We've heard so many lovely stories today of Dr. Rasik Shah's journey when he pioneered MAPS here in Bombay, along with such big luminaries who are here. Let us never forget that laparoscopy, when it came as a revolution. And I'm sure it got a lot of mother-in-law treatment from the established surgical discipline of the day. And after a few decades, it has made itself an acceptable specialty. And now it's comfortable in a place where suddenly there is a new kid on the block. The new kid on the block, robotic surgery, who doesn't want to go through adolescence, he doesn't want to go through the young adulthood, he wants to go straight from infancy all the way to adulthood. But let us remember our own mother-in-law like treatment which we receive, and make sure that we are open in our minds today that it will come through. And I was very touched for this thought, because last year this young man, who is such a doyen of pediatric laparoscopic surgery, was so excited and he posted so many pictures of himself, and he did a small write-up for us for the PESI newsletter, where he had gone to a robotic setup, and he had his hands on the new toy, he took pictures, he took video, and he shared it, and he said, hey, this is okay. I think that exemplifies his desire not just to teach people, we've heard of that today, not just of mentoring, but also of learning and never feeling full. On a personal note, sir, laparoscopy has grown, as Amdekar sir said, so beautifully. I had written this down, sir, before you said it, but you absolutely laid the stage for it. Has grown not just because of techniques or instruments or scopes or equipment, but by the perseverance of the people pushing. We are here to celebrate one such man who, at one phone call of his, so many of us from across the country have not hesitated to leave home and come, even if it is, such short notice. And we celebrate your mentorship, we celebrate your nurturing of so many young surgeons. As the secretary of PESI, I have to really acknowledge that you keep training so many youngsters. I'm sure this will be hundreds right now. And most of you in this hall have known him for many years, from whatever we have heard. I have known him only for 5 years. 5 years ago, I had not spoken to this man. I was intimidated. But just knowing him for 5 years, today I feel I've known him my entire life. That is the quality you have of touching people. And thank you for that, sir. So while we look forward to the golden anniversary of Ma'am Archana and you, we will also look forward to your golden anniversary here in Bombay for MAPS and your union. Thank you so much, sir. Thank you.
Thank you so much, bro. Now coming to the most exciting part of the program, दुष्यंत कुमार's word beautifully conveyed. कौन कहता है आसमान में सुराख नहीं हो सकता, एक पत्थर तो तबीयत से उछाल हो जाता. In one line, Dr. Rasik Shah embodies this spirit, a visionary who defies limitations. I now invite Dr. Rasik Shah to share his enlightening insights with us.
Thank you, one and all, who are sitting over here. First of all, I am going to thank those who I need to. The list is endless. I think everybody who is sitting here is somehow supported me. And that is the reason why you are here. First of all, I thank my family, यूजुअली थैंक हैपन्स लास्ट, सब खत्म होने के बाद, लेकिन मैं पहले शुरू करना चाहूँगा. So my family with my parents, my mother who taught me writing 1, 2, 3, 4, 5 is Gujarati में. My wife, my daughters, parents, an entire family member. The second comes the teachers. My foundation was by Mrs. Kirtane in pediatric surgery. Then I learned from home lobe, laparoscopic surgery in USA. After I came back here in India, I learned from quite a few of teachers around. Particularly, if I have to remember, apart from home lobe, it was Dr. Bhaskar Rao, pediatric cancer surgeon at St. Jude Hospital. So from two of these I learned in USA. Of course, there were many more teachers also over there. Then, after coming back in India, I learned from a lot of people, but Dr. Udvadia is special, who started CMUS, now it is IMUS, where I got the opportunity to showcase my skill, not only skills, but I learned while teaching. And that is the best way of learning. So all my teachers, my students, you learn a lot from students. When they ask you some question, you start thinking. Many times we may not know the answer, but then we think and we realize what is the correct answer. My colleagues, I think a lot of people have spoken about me, what I am, what not I am. Like everybody says I am very patient, but I lose sometimes my temper also. And few occasions, I don't want to enumerate right now over here. Let's continue. So my colleagues, I think we learn from each other a lot. When we do all these workshops and other things we learn. So all these people I think who has contributed in my life somewhere or other. Now if I am to go back to the journey of laparoscopy surgery, it all started on 6th December 1992 when we had organized that Silver Jubilee program workshop in JJ Hospital, and we had a dinner at Mrs. Kirtane's house with the faculty who had come from GOS London, Dr. Ed Kaigi and Dr. Ansley. So over the dinner I asked him, as a young surgeon, what you will advise? I asked Dr. Ed Kaigi. And he said, pick up laparoscopic surgery. I think that was the day on which he told us, of course, that is the day on which the Babri Masjid was took down, demolished. And then I was trying to go abroad somewhere or other, and finally I reached here. Again, Dasmit was there, where we had to go through a lot of problems. It was not easy to get visa, and there were a lot of issues. Dasmit and I had gone to Mantralaya, I think you may remember, you may not remember. For we had to take NOC from government, and then we had to manipulate a lot of things, and finally we got it, and I went abroad and came back in 98. So when I went in US, basically I learned laparoscopy surgery, which was again, that was a developing field at that time. It is probably, now it is more or less developed, we can say. But a lot of things are getting still defined and refined. It is not that everything is clear even today. Particularly in oncosurgery, if we have to see laparoscopy in oncosurgery, it is still in infancy, it is not picked up a lot. But so I came back in 98, and when I came back in 98 in India, there were a lot of issues. It was not easy to push laparoscopy at that point. Multiple problems. What were the problems? Problem was to get the equipment. There was no equipment available in India. So equipment problem. The second problem was to get the affiliation in the hospitals, because those who are existing, they will not allow you to get in. The third problem was getting the patients. That okay, you have come back, you have some skills, but you need to have patients to showcase that you can do it. And then there are many other issues which we had to sort out. So if I have to touch upon, so what I did was, first thing was to get the equipment. So I got in touch with two companies, which is Precious Surgicals and Home Surgicals. They made first set of 3.5mm instruments in India, and then they started marketing for others also. So to get the specification and all that took quite a long time. The second point I said, to get the hospital affiliation. So I started with J Clinic and then slowly and steadily many other hospitals gave the opportunity to do this. And equipment, one of the major part which I have to tell you is my friend Mahesh Thakkar. Please. He was classmate, not only classmate, he is a dental surgeon at Miglani. He loaned me his entire set of equipment, which includes camera, light source, TV monitor. Like I used to carry 6 bags, which Dr. Oak and many others told. So Dr. Mahesh Thakkar, he gave me his camera, light source, insufflator, which I used to carry, and almost for 2 to 3 years. Not only that, he gave me the patients to operate. So I used to go to Mulund almost 2 to 3 times in a week and operate on these patients. Of course, they were adults, but it helped me learning laparoscopy, refining my skills. And not only that, he paid me also. I think you need to have good friends like him, particularly when you are coming from outside where nobody knows Dr. Rasik Shah, nobody knows pediatric laparoscopy surgery. You are fighting on multiple levels. And not only he paid me, and then he said, if you want, we can make you settle at Mulund. But he said, no, you need to be in South Mumbai. You don't have to come to Mumbai. You cannot be remembering all this, but this is whatever, there are a lot of things which I cannot forget. So he gave me the patience and money also. This is my first 2-3 years. He was a big support. Along with him, Dr. Sandesh Shah was also sitting next to him. Again, he is a rolling practice in one of the maximum number of patients he sees, I think, even today. So these are, we were very close group since MBBS, and we supported each other a lot. So apart from this, to get patients like Dr. Sanja Oak and many others helped me. So I used to go and operate everywhere. The idea was to promote laparoscopy, idea was to learn, the idea was to teach. So we continued doing that. Sandesh has told us about first hospital pull-through which we did in the Nair Hospital. And again, I thank from bottom of my heart whoever was instrumental in doing that, because they changed the tone across Mumbai and many other parts, that even if we can do hospital in a small child, then many more things can be done in a laparoscopy or minimal access surgical way. I still remember even today when I did my first cases. Like I remember May 1999, my first orthopaxy referred by Dr. Bharat. My first empyema referred by Dr. Amdekar, somewhere during that time. The Dr. Deepraj said about pyloromytomy was referred by Dr. Samdani. My first hospital pull-through in infant was referred by Dr. Narayana Health. I still remember how that patient were, whatever they, lot of things about this patient, because you can't forget them. And I am definitely thankful of all the seniors, pediatricians, who supported the new way of doing it laparoscopically. Again, in Empire, the laparoscopy took off very fast because Dr. Amdekar promoted it. Otherwise, it would have taken a long time. So again, thank you, Dr. Amdekar, for doing that, because he saw how it has changed the course of illness among the patients. As I had told you, I think one of the things which I must tell you that there are 4 stages of learning. One is what is written in belly law. First is reading, second is assessing, third is operating, and fourth, which I genuinely feel, is teaching. When you start teaching, you simplify the procedure, and when you simplify, you start thinking when you are teaching, and particularly when you are teaching laparoscopy, you don't need to scrub also. You can just show on the monitor, do this, do that, which a lot of telemetry people do it today also. So you can teach all these things on the monitor, and when you are teaching, you start thinking how to simplify the operation, and that helps us a lot in learning. So all these things helps us. Then if I have to say, then was the spreading the knowledge of laparoscopy surgery. So we started teaching, and when I say teaching, initially when I started teaching, I remember Dr. Sandesh Parelkar one day telling me, if you are teaching, you are creating a competition. I did not understand much about that, because I always felt that there is enough work for everybody. And if you ask from my bottom of heart what actually I want to be, I think I like teaching. I don't know, I like teaching, and I continue doing that. Even in 98, I do it today also. So in one of the form I had to fill up what you want to, recognize it. So I wrote teacher, not pediatric surgeon, not doctor, not laparoscopic surgeon, but teacher. I think teacher, like Vikesh said or Prakash said, that when you are teaching one surgeon, you are going to help many more children. So here we taught pediatric surgeons, we taught general surgeons also the art of minimal access pediatric surgery. And whoever wants them to learn, even urologists, though they don't teach pediatric surgeons, but we teach everybody. So it's ultimately, I think, what you want to be. So since beginning, I had that feeling that I want to teach everybody. So I did not leave any opportunity to teach. Once I was discussing with Mohan Abraham from Kochi. So we were discussing something. So he said that you got the opportunity and you took off that. Even he had the opportunity, but he said I could not do it. So many times we get the opportunity, but we do not recognize that is an opportunity, and we pass it off, and then somebody else takes away. So we continued teaching, and at the same time we were able to now here, like I think Robert said, many of us, that is, we learn from each other. So when we formed PACI in 2005, we started learning from each other. I think that was the best way we learned. Because when I was in US in 95 to 98, that department was learning. It was not that we learned everything. So first pyloromyotomy was done during my tenure. First nephrectomy was done. First PDA ligation was done. So a lot of things were happening for the first time, and many things were not even done at that time. Like repair of diaphragmatic hernia, deep fistula, and many other things were not being done even at that time in the institute where I was working. But when I came back, I'll give you an example. It was not easy to carry out many of these procedures because there was nothing written. So you have to think on your own. So for an example, when I did my first orthopaxy, I had not done in USA. But I could not tell pediatrician that I have not done because they will not refer there. So I went to the library, like Dr. Samdani said. So we have a big library in JJ Hospital. So I went there As an alumni, we are allowed to go to the library of our alma mater. So I went there. There were 20 articles which I read on that day before doing orthopaxy or posting the kit for orthopaxy. And I read, then I had to create my own technique because it's not everything was written. So you have to sit down on the previous day, meditate how you are going to do, and then you do on the next day. Of course, at that time, Deepraj must have assisted me, like many other procedures which we were doing for the first time. So I read 20 articles, then we operated. We created our own technique and operated. I still do the same with some refinements. Now there are a lot of things which we changed because of the feedback. Now Mrs. Kirtane does not remember, but once I was doing some orthopaxy at JJ Hospital. I operated in all hospitals, all government hospitals, Nayar, JJ, Wadia, KM, Science. I got chance to help them in establishing their department. So I was doing one orthopaxy in JJ Hospital, and at that time I told if I had gone and done this, like go to the media, to the vessels, it would have been good. So Madam just said, why didn't you do it? So I think after that I never brought out from the internal ring, it is always medial to the epigastric vessels. So like that, when you get the feedback, you start thinking whether this is correct, not correct, whether we should do it or not. So like that, we devised a lot of techniques and we carried out. Many of the things are published together, like Deepraj and me have 21 publication together. He is better organized than me. I may have been organized well, but he is better than me for sure. So we used to read from the journals. It was not easy, not YouTube, not Google. So you have to go and read, and then you devise your own technique. And then we got the opportunity. I presented my first 2 papers in Kolkata conference in 1999 on laparoscopy. At that time, nobody was interested in laparoscopy. It was an adjacent room where 10-15 of us will sit and discuss. The real thirst came in 2005 when we formed PCIAPS. It was formed in Coimbatore with the effort of Dr. Ramkumar Raghupati, good friend of us. He died a couple of years back. We miss him today. Dr. Zurai Rajan and Dr. Ramkumar Raghupati, they were instrumental in getting us all together as a PCIAPS group, and since then first conference was organized at Agra, the PACI conference. I think we started learning from each other, and that was a turning point. In 2012, another thing which happened was the YouTube which came into the place, and because of YouTube, again, as Dr. Amdekar was saying, that we have to be forefront of using the technology. And somehow, I am not sure why, but I get into it somehow easily. So my first videos were, edited videos were published on YouTube way back in 2012. And then once I had uploaded 5-6 videos, the feedback was whether you want to have your own YouTube channel. So that YouTube channel on my name is since 2012. After that, again, I think a lot of people have said about CMUS and IMUS, and I must thank Dr. Udwadia for taking me as a faculty director for pediatric surgery in that place, and that gave me the opportunity to teach. Prior to that, we used to organize courses, but they were not structured courses, they were not planned. We were trying to teach, but the teaching part, what happened at IMUS or CMUS was excellent. We must have organized more than 65-70 courses over the last 10 to 11 years, and more than 450 candidates, or maybe more, I don't have the exact count. They came, they learned, they went back, and then many of them are teaching their students today. So the one person and then the group of people, it is not only me, I think it is everything, all our courses, there are people who assist me which include from Bombay, Ketan Parikh, Sandesh Parelkar. They are part of our program. Apart from that, we take quite a few juniors also. Ultimately, because the juniors have to take over whatever we are doing. So, from outside Bombay, Ramesh was the part in my first course, which was in old CMS. Even Ramesh Babu, Vikesh, Prakash, everybody has come and visited IMS as a faculty. And when they visit, I am learning from them because I am sitting there, they are teaching, and then you keep on learning. I think that helped me a lot. It may have helped them, but it has helped me 100%. There is no doubt about that. So we learn from each other more than anybody else. So 2012 YouTube videos, and today I think I have more than 100 plus videos of my own, and then there are many others which are good source of information for many of our colleagues. Many of them have come and expressed that these videos keep helping them, and that keeps us motivating and putting more edited videos. Of course, today there are thousands of videos are available on YouTube. So after YouTube came the IMS and CMS, where we taught everybody, and that has definitely helped us. So this journey has been wonderful. Now there are many things which I can talk as a motivating, to the younger people, but I don't want to bore many of you with all this thing. But only few things which I would say is why I went abroad, because I saw that most of the people who went abroad and came back, they were doing better in the practice. But it is definitely not necessary that you have to go abroad and then only you can be successful. You can be successful over here also, but if you think across, then there were a lot of people who had gone abroad, came back with some extra knowledge, they were doing better in the practice. And that was the reason I thought I should go, particularly when you want to practice in South Bombay, which is very competitive. It is in any part of the world you go, I think, and competition is good. It is healthy competition is good. That is what I believe. And you are on your toes continuously to learn and to be at par or better than others. So that is very important, and that helped us. So that was the reason I went, and I was fortunate to get into the place which was one of the best places to learn laparoscopy. So there is a lot of destiny. It is not. I don't think it is that I am more intelligent or anything. I don't think so. It is just you want to be. You want to do something which is correct, and you are on verge of doing something which is better. You are looking for something which is good, and then everybody is there to help. Like everybody says, I have a lot of patience, but when I shout, I just can't control me. So I think Dr. Vijay had once that, I don't know whether, so he did not know me a lot, but one day we had a fight. So I do lose temper, and I don't want to lose because then I can't control myself. But what I would say, so particularly for juniors, you need to define your goals, your dreams, your problems. Once you define that, then you can find the solution for that. Now, solution does not come very easily. The solution, you need to meditate, you need to discuss. I can give you 2 examples of discussing with seniors. So I discussed with Dr. Samdani told about laparoscopy. Then after I came back, I discussed with Dr. how to get the patients from pediatricians. And he said, I don't know, I never got succeeded in that. So he said, I don't know. But then I told him, I know laparoscopy and I think the patient will come. So he said, you need to get endorsement from your colleagues, means pediatric surgeons. You need to get endorsement from them. And I did not understand much about that, what that means. But Then over next 1 year, 2 years, I realized what exactly it means. I was in air when I came back. To reach the ground level, it took me 6 months because nobody will look at you. It is, okay, you know laparoscopy, who cares? So it took me 6 months and then I realized the problem. The problem was that if you go and tell anything to your pediatrician, any pediatrician, what they are going to do, they are going to ask the colleague pediatric surgeon. That अरे वो रसिक तो बोल रहा है ये करेगा वो करेगा, actually कुछ होता है क्या ऐसा? Now what colleague pediatric surgeon, even they did not know what is laparoscopy. So ultimately it was zero. So then we started teaching that to the pediatric surgeons, and over the years everybody came into the bandwagon of pediatric laparoscopy surgery. So that is what when we discuss with seniors, we realize that this is what it is. Similarly, I had discussion with Dr. Amdekar in JJ group of hospitals. I used to go, काम धंधा था नहीं, तो क्या करने हैं, घर पे तो बैठ नहीं सकते, so you have to go out and do something. So I went one day to JJ and sir met me in the corridor somewhere and I told him about empyema. That we do empymas thoracoscopically, these are the advantages, this is what it is. And one fine day, somewhere in 1999, he called up. Rasik, I have a patient like this, where can you do it? So I had attachment of Jain Clinic only at that time. It's a small charitable hospital. But the hospital which has a vision, they had a laparoscopy set. Even in 99, it was a set which probably was the first one in city of Mumbai. The adult set, maybe not first, Karl Stoska, probably first or second, because Dr. H.G. Doctor used to be there. And he was instrumental getting all the equipments in Jain Clinic. And we had the entire set of even 3mm instrument in year 2000 in Jain Clinic, which was charitable place nowhere else in city of Mumbai. In Hinduja, I am talking about the head instruments, which we got it made in India. So even in Hinduja, it came in 2009, after I was joined 7 years into. So like that means it was the situation was like that there was so in Jain Clinic I basically operated that patient, and the endorsement of the senior pediatrician definitely helped pushing the minimally invasive surgery like anything. Particularly empyema took off much faster than many more laparoscopic surgery. We are thankful to you, sir, for endorsing thoracoscopy in empyema. There are many stories over last 25 years which has happened. So 25 years back there was a dream that I want to be known as a pediatric surgeon. Today I think that dream is fulfilled, and that is why we are doing this celebration. At that time there was a lot of confusion. Only thing was, if it happens in USA, it has to happen here. It may take time, but ultimately it has to come. Something which is good for children, it has to come in. On that point, we continued working. So, for juniors, if I have to tell that you have to have your dream, your goals, your problems, so discuss with seniors, then have a path, how we are going to execute. There will be multiple options and you have to choose something which not everybody is going to do. And you choose that, you start working on it. Once you define your goals and dreams, I think you will achieve it. You have to 100% think like Sanja Oak used to say, that if you want to learn laparoscopy, now it applies to anything, that you think about that when you are sleeping, when you are eating, when you are writing, whenever you are doing anything. You have to think about that, and then I think nobody can stop you learning. So like that, there are many anecdotes. I was talking about Dr. Sandesh Parelkar. So he said that so creating competition. So then he says that Dennis Brown said that pediatric surgeons are there to set the standard of care and not monopoly. I think there are a lot of things which have happened over the years while interacting with all of you, where I have learned a lot and we keep on learning. And again, I don't want to give a lot of big talks about anything else, but I am very happy that all of you are here today, and many of you have expressed yourself about me. I am really thankful for that. Before I end, I will like to felicitate few of my teachers. I think all of you are teachers for me. You have taught me something or other. But as this mark of respect, I will like to felicitate my teachers, some of seniors, some of my colleagues who have helped me in setting the practice over here, and even my students, some of them. I have brought few shawls, so whatever that number is over, then it will be over. But all of you are my teachers, and I will definitely like to do that before I end. So first of all, I told you like my teachers, which include Dr. Mrs. Kirtane, Dr. Thomlo, Dr. Udvadia, but here I request Mrs. Kirtane to come forward, and I request my wife Archana to be with me in felicitating her. Invite Dr. Samdani and Dr. Amdekar also, because they supported in the beginning. I think that was necessary for pediatric laparoscopy to grow in city of Mumbai. Deepraj, Sandesh, Sanja Oak, please come forward. Ketan left, but Ketan is there. Very good. Thank you. So I told Ketan, for showcasing I needed patience. So Ketan was one of the first pediatric surgeon in private practice who said that let's do it together. Please. Mahesh Thakkar, please.
Sandesh. Senior most Ketan.
and Koru Senior, they joined together. Almost we were about to go appear for the exam. They joined about 3-4 months prior to that. Now we wanted to read. And one of the surgery which we were hating at that time was Vikesh. There were so many Vikesh we have to do. So first time I told him, I showed him how to do it. Second time I told him I will assist you. This happened within gap of 7, 8, 10 days. The third time I said, you will do it, I am reading at room. If there is any problem, you call me. So we go along long way. I did my first splenectomy after coming back in India in one hospital at Pune. I remember even exactly what we did, how we did, even today. Thank you very much. And to all my students, I am very thankful to you, but as a token of appreciation, I will call Vikesh and Prakash. This was planned today afternoon only. So whatever I had shawls, we were okay. I said let's take it and we'll do it. Again, I am very thankful from bottom of my heart that all of you are here. And this celebration which was how to do it, I did not know and we did it. So thank you very much. Many of my friends are here, my financial advisor or my portfolio manager, Deva, please sir. He takes care of my finances. So, he's Devnathan and I think many of you know by name. So, whatever I don't admit, my advice is some people do take in which stock to be invested. So whatever he has invested for me, of that something if I like it, I tell them. So again, thank you Deva for managing my portfolio. Thank you. Because he takes care of my finances, I am this bothered and so thank you Deva for doing that for me. I will request Vikesh to take over the final part. Thank you.
Truly inspiring, sir. You really deserve a standing ovation. Somewhere on your journey, don't forget to turn around and enjoy the view. Today was all about reliving that journey and cherishing each small step that has led us thus far. My only wish going forward for minimal access pediatric surgery in India is forever onward, forever onward. Thank you very much. Let us enjoy the fellowship and dinner together.
Before we go for the dinner, I think all of you know that my elder daughter Ranjana, she has found the life partner Mr. Miguel, who is Spanish. Where are you? So I request them and my younger daughter Ravina to come forward. Do give blessings to them. Come. We will have more cake-cutting ceremony. KJP Cake Manager, Mahendra Bhai.
Congratulations and celebrations when I tell everyone that you're in love with me. Congratulations and jubilations. I want the world to know I'm happy as can be. Who would believe that I could be happy and contented? I used to think that happiness hadn't been invented. But that was in the bad old days before I met you. When I let you walk into my heart. Congratulations and celebrations when I tell everyone that you're in love with me. Congratulations and jubilations. I want the world to know I'm happy as can be.
Earlier I was thinking to have this program in hospital, but because my entire family is here, I said might as well have outside and
To be young and in love in New York City. Do not know who I am, but still know that I'm good long as you're here with me. To be drunk and in love in New York City. Midnight into morning coffee, burning through the hours talking. Damn, I like me better when I'm with you. I like me better when I'm with you. I knew from the first time I stayed for a long time, 'cause I like me better when I'm with you. I don't know what it is, but I got that feeling. Waking up in this bed next to you, swear the room, yeah, got no ceiling. If we lay, let the day just pass us by. I might get to too much talking, I might have to tell you something. Damn, I like me better when I'm with you. I like me better when I'm with you. I knew from the first time I stayed for a long time, 'cause I like me better when I'm with you. Stay with me. Stay a while, oh. Stay a while, stay with me. Stay here with me. I like me better when I'm with you. I like me better when I'm with you. I knew from the first time I stayed for a long time, 'cause I like me better when I'm with you.